Hi everybody, I'm Sheldon coming to you from Forte, here to discuss the neck. I have Mildred here, my trusty sidekick, who is going to help us in looking at the anatomy of the neck, and then we'll discuss a few issues that can be caused from having problems with your neck, and then also exercises that can help. So, the head is attached and sits on the cervical spine. The cervical spine has 7 bones. They are called vertebrae. Their main position causes them to be a source of protection for the spinal cord itself, which runs through the center of the spinal column. The spinal column is created by stacking one vertebrae on top of the other from here all the way down. In between each vertebrae, an intervertebral disc is sandwiched, and this is a very important structure as well because it provides space for these spinal nerves to exit. It also acts as a shock absorber, and it also helps to be a structural supportive structure for the spine. Along with the bones, the discs, the ligaments, so there are ligaments that also connect each vertebra as well as ligaments that run along the entire length of the spine. There are also muscles that are very important in keeping this neck structurally stable, as well as to move it and give us the ability to turn our heads, move our heads in whatever position we deem fit. Knowing these structures is very good to start off how we end up causing injury to our neck, and generally with injury then there is pain and other symptoms. One of the things we're going to discuss today is nerve-related pain. Now, nerve-related pain happens whenever any one of these spinal nerves, as they exit, they get squeezed by any one structure that operates in and around that area. Okay? So let's talk a little bit about the vertebrae and how they can cause issues to these nerves. As wear and tear happens over our years in life, there can be degenerative changes that occur at the bone level. And what can happen is, with that change in shape of the bone, because that's one of the things that arthritis or arthritic changes, right, cause the bone to become malformed or mal-shaped or ill-shaped. And what happens is those ill-shaped, and sometimes there are projections that come off of the vertebrae that can actually squeeze and affect the function of the nerve. Also, the intervertebral discs themselves, they can become ballooned or pushed out against that very same nerve, and then again can cause symptoms. With those things happening at the level of the neck, you can exhibit pain because it will be an abnormality within the spine. Also, not only pain in the neck itself, but if these nerves are affected, if any one of these nerves are affected, their branchings and the branches that come from here and are formed by joining of the various nerves that come through here, it can actually affect the entire upper extremity, because that's where a majority of the nerves are supplied. So your symptoms can range from weakness, tingling, burning, numbness, or pins and needles as described by any one individual. So if you have an amalgamation or one or two of these symptoms, then it's very likely that it can be coming from the nerve. And the only way to really find out such a thing is to visit your doctor and find out exactly what your diagnosis is. Now, with these issues, sometimes it can be something that can be fixed by yourself. So I'll just run through 2 simple exercises that can be used to help with nerve pain. One such exercise is simply placing both hands interlaced at the back of the head, right? Pressing the back of the head into the hands, opening the elbows and pressing back, lifting that chest, getting that big chest, and looking slightly up towards the ceiling, and then releasing. And that can be done a few more times to get good efficacy. Alright, next up, you're going to hold. So if this is your affected side, so we've been looking at the left side, so I'll use the left side on myself as well as the target. So if you're having left-sided neck pain as well as tingling going down, this could help. You can hold the left hand with the right hand, straighten it down, and what that does, it pulls your chest up or brings you out of that hunched forward position that a lot of us like. And once we've done that, then we can side bend to the opposite side. So as I'm doing that, I'm getting a nice stretch along the left side of my neck. Then we can take that stretch even further and we can look down towards our right toe. And then we'll come back up in the same sequence that we went down. And in doing so, you can relieve some tension in the muscles and in some of the other structures that are been tight and wound up because of the pain that you're having from the neck. Now, if these symptoms aren't relieved by this, and sometimes they might not be, it's wise that you ask your doctor about physical therapy, because we as physical therapists can help in reducing that issue, finding out the root cause, because sometimes it can be just our postures that we maintain or certain positions that we've been in for long times. It can be your desk, could be from trauma, from a car accident, can be a wide host of things. But as your physiotherapist works with you, you can work towards improving those things, reducing the outside external factors that we can modify, as well as working towards reducing your pain, reducing the over-recruitment of muscles, etc., to help you to be a better person and to be in less pain, discomfort, and improve on your quality of life. So that's it from me here at Body Forte. Stay tuned to our next adventure as we take you on the journey to exploring your body. Take care.